Hi, welcome to CT Guided Biopsy at www.ctbiopsy.com. This is Dr. Bhavin Jankaria, and today we're on a 161st case, and I'm going to talk about temporal bone biopsy. And even though this seems a little esoteric, perhaps difficult, this particular case has a lower level of difficulty at just 3 by 5. So, this 59-year-old presented with pain and swelling in the left temporal region. She was treated for carcinoma recto-sigmoid 6 months prior. And you can see on the MRI there is an osteolytic lesion in the squamous temporal bone with soft tissue on both sides. A little necrotic, I guess, here, and the PET CT showed the same thing. Now the question was, there is no other lesion in the body, and this is a very unusual site for metastasis from rectosigmoid. And so the question was, is this truly metastatic? I mean, it looks like that morphologically, or is it something else? So the best approach just seemed to be going parallel to the bone and hitting the soft tissue here and biopsying it. The pre-procedural checks were absolutely fine. The patient had a normal coagulation profile. We needed material for histology and microbiology. During the procedure, all checks were absolutely fine. So I've used an 18 gauge barred shot. The initial idea was to just use a 10 millimeter throw, but eventually I used the entire throw as well. So you can see it going in. We had given a little conscious sedation. Here I am adjacent to the osteolytic lesion, and since you're parallel, there's no way you're going to go inside. And here I've deployed the gun and biopsied this. And this was initially with the 10 millimeter throw, and now I've used the 20 millimeter throw as well. Post procedure, there was no problem. The patient waited for an hour and then went home. So the working diagnosis was MEDS, not really osteomyelitis, but maybe anything else, and it turned out to be metastatic adenocarcinoma. And basically, it took about 12 minutes to do in the supine position, and we gave conscious sedation. So this is basically the summary of the entire process. And so I looked at a bunch of my temporal bone biopsies over the last few years and realized that we've done a few and they're not really difficult. So here's a patient with an expansile lesion involving the temporal bone and the posterior zygomatic arch. We've got fluid levels here. In this region, this would represent something like a giant cell reparative granuloma. So basically, with the head turned towards the opposite side, just went into the osteolytic lesion. So somewhere here, straight in, biopsied this, and that is what it turned out to be. Then there was this patient treated for CA nasopharynx who came with this abnormal soft tissue extending into the bone. So you've got an osteolytic lesion, extensive amount of edema and swelling. That was what was on the PET, and I think the idea was to either get material for culture and as well to rule out malignancy. And this is simple, right? You just turn the head to the other side. There is an osteolytic lesion. Just put the needle inside. I aspirated, didn't get pus. Did a biopsy. There was inflammation, no malignancy, and no organism was cultured. And this was interesting. So here's a patient who's had a long standing infection that's not coming under control. So the infectious disease physician wanted a re-look at the entire process. You see the MR, there's fluid in the mastoid, the soft tissue around the mastoid process, and the PET didn't show any uptake in the mastoid cells, but does show perimastoid soft tissue. And actually, then this is quite easy. So my choice was to go into the bone or into the perimastoid soft tissue. When the patient came in, put him in the prone position, a little tilt towards the opposite side, and then did a contrast study to figure out where everything is. So the vertebral, the carotids, all far away. Facial nerves nowhere near as well, and that's the soft tissue. There's enough play here, so then I just used an 18 gauge cook adjacent to the mastoid, biopsied the soft tissue. It actually turned out to be Aspergillus PCR positive. So different parts of the temporal bone can usually be approached quite easily for CT guided biopsy, depending obviously on the location and pathology. The link to the table of contents, other sites and cases if you're interested. This is what I did. I updated my salt stuff at Atmos first, and that's the bone and soft tissue. The answer is up, and I should have a new case in about 2 or 3 days. And this is the CT chest where I put in the chylothorax conundrum. Sorry, this is the lecture that I took on infection mimics. Completely forgot. What am I saying? Yeah, and that's that. So you know where to comment, email, subscribe, etc. Thank you so much for viewing this. Take care. Bye bye.